I am at CranioSacred Austin with Rachel Carter, who is the massage therapist that is going to make an incredible presentation today, informing us about her work and how it goes hand in hand with the work that we do as clinical therapists, working with trauma, working with individuals experiencing adverse experiences in and of themselves. So without any more ado from myself, I'm going to turn it over to you, Rachel.
Thank you for that.
I wish you all were here to experience presencing with her.
Thank you, guys. So it's true, I am Rachel Carter, and I'm at CranioSacred Austin. I'm a craniosacral therapist, and I first started learning in 2008, so that's a little chunk of time. I practice up-ledger craniosacral therapy. There's a bunch of different craniosacral flavors that you can pick from. Up-ledger tends to be a little bit more grounded in anatomy and physiology, with, you know, a little dose of woo in there too. So today I'm hoping to give you guys a high level, just going over of the left brain parts of craniosacral therapy, what it is, how it works, how it feels when you're on the table. And also I'd like to go into somato-emotional release, and that has a lot more to do with your work with trauma. So that will be mostly in the second half of the presentation. The first half will be mostly about anatomy and the left brain portions. Okay, let's jump right in. Welcome to the world of craniosacral therapy. It's a wild world, and if you look it up online, I find it's difficult for people to really ground themselves in what it is, because quite frankly, most times you look it up, it looks like crap on paper. You really have to have a felt experience to really understand what it's about. And in bringing you guys into that felt experience, I want you to understand that what we're really introducing you to is a new paradigm. And that's going to require some softening of your paradigms and belief systems that you already have. So some pointers for you guys to keep in mind. The first one, you may have learned in elementary school that the cranial bones are fused like a coconut. Turns out that's not actually true. They actually move in concert with each other along with the cranial rhythm. We know this because Dr. Upledger, the founder of craniosacral therapy, the way it's practiced now, studied fresh cranial bone specimens rather than chemically preserved ones, and under optical and electron microscopy, it showed the existence of itty-bitty blood vessels, nerve fibers, collagen, and elastin fibers within the cranial sutures. Basically, that means that they're built to move. Also, they attached electrodes to monkeys, and these electrodes were very sensitive. They were able to send radio signals in between each other and map minute movements in the cranial bones, and they found that in fact they do move. So that next point there, 5 grams of pressure, along with the concentration of the practitioner and the cooperation of the client's inner wisdom, can move bone. All right, so there's 2 things I want you to focus on in that point. First, 5 grams of pressure, that's a tiny force. Imagine lifting up a nickel on your pointer finger. The amount of force it takes to do that is about 5 grams. You could also imagine putting a piece of cellophane over water and then going up underneath it and just dragging that cellophane across the water. That also takes about 5 grams of pressure. It's a tiny force. The next thing I want you to focus on there, the client's inner wisdom. Now, what does that mean? that's the part of them that is connected to, I'm a Christian, so I would say to Christ, to the Holy Spirit. It's the part of them that knows exactly what they need and remembers everything. If we tap into that, our concentration, along with the power of that person's inner wisdom or inner physician, can make huge sweeping changes very, very quickly. Next, as far as the body is concerned, all time happens now. Um, all the body stories are condensed into the present, and it can be, as a therapist, it's really humbling to see this in practice. Sometimes when you have your hands on somebody who's gone through severe trauma, um, for instance, molestation, you can hear the cries of that child, and it will sound like a child, and you can be there and you can ground what's going on in the tissue to that felt experience. And just witnessing it, letting those parts speak, it recasts the person's relationship with themselves and allows them to move forward in a different way. 4 core concepts to keep in mind as you're changing your paradigm. The body is a unit. You can also this holism. I think that's the fancy word for it. But it means that you cannot separate what goes on in the pinky toe from what goes on up in the membranes of the head. You've heard of that old adage, a butterfly flapping its wings on one side of the world makes a hurricane on the other side. It's kind of like that when we're talking about the body. Structure and function are interrelated. So y'all put your hands on your foreheads. That bone is hard. And it's made to be hard. It's made to take forces because a lot of the time we are not headed and we run headlong into things. So it's a good thing. It's a good thing, and it's infinite wisdom that it is made that way. All right, the body is a self-regulating, self-correcting mechanism. That is very important. That means that as a practitioner, I don't bulldoze in with the attitude that I need to fix or change anything. No matter what I find or how wonky it might feel under my hands, I trust that the body has arranged it that way for a really good reason that I just don't understand yet. And that if I go in and I support all of those patterns with my hands and with respect for the tissues, the body will begin to self-correct. I'll begin to feel movement in places where I have no idea how that's even possible. It can feel so locked down sometimes, but it will begin to move. It will begin to breathe. Things change. We support people where we're at, probably much like you do in your sessions. Next concept there, movement is health. If I put my hands on something and it doesn't move, it feels sluggish, congested, ratchety, I know that that's an area where the inner wisdom may want me to stay because movement is health. Next slide. So this is a lot of information. Just let it wash over you. Don't be too concerned about the details. The core of the craniosacral system is made up of the meninges, the bones of the head and the spine, cerebrospinal fluid, the brain and its cranial nerves, and the overlapping immune, endocrine, lymphatic, cardiovascular, and musculoskeletal systems. So the meninges, you guys know what that is. That's the lining of your brain and your spinal cord. It's got a few layers to it, and I'll be talking about what those are. Cerebrospinal fluid, it's important to discuss that for just a minute. It's made in the ventricles of the brain, mostly in the lateral ventricles. And its job is to cushion the nervous system and to take care of wastes and also to bring nourishment into those delicate neural tissues. And as therapists, we work with and around other systems of the body. The craniosacral system is a discrete system and it's got its own rhythm, just like you have a cardio rhythm. You've got a craniosacral rhythm too. but it works alongside all the other systems: lymphatic, immune, endocrine, cardiovascular. And I'll do some massage along with craniosacral. We are big proponents of doing what works and communicating with whatever system the inner wisdom tells us we need to. All right, the craniosacral system and the cycling of cerebrospinal fluid within it creates your cranial rhythm. So every 6 to 12 seconds, your entire body will expand and contract. And that expansion and contraction, you have to have trained hands to feel it. But you will move kind of horizontally, whoosh, out, and then back in, whoosh. And that happens every 6 to 12 seconds. We call the expansion phase flexion, and that happens when the system, in particular the ventricles of the brain, the little water balloons on the inside, when they fill with cerebrospinal fluid. The contraction phase we call extension, and that happens when the cerebrospinal fluid is reabsorbed back into venous blood flow. We'll be having a video that kind of walks you through all of this. So for right now, just take that in as a gestalt. Next slide. And there we go. There's the ventricles of the brain. Those big ones there, kind of on the top, those are the lateral ventricles. And those have the highest concentration of ependymal cells. Those are the cells that actually filter the cerebrospinal fluid from the blood. Kind of in the center there, that's the third ventricle. And then down toward the brainstem, that's the fourth ventricle. Just so you guys kind of have a model for what this thing looks like. All right, next slide. Okay, and how do we assess this rhythm? Kind of like how wine enthusiasts would describe a wine, we have a system called SQUAR, and that stands for symmetry, quality, amplitude, and rate. The quality of your cranial rhythm is going to determine the condition of your health, mental and physical. Every rhythm has its own personality. So when we're talking about symmetry, what we mean is, do both sides of the body do the same thing? Are they both opening up into flexion and then going back inward into extension the same amount? Does it feel equal? Quality, that's a little bit more abstract. You'll hear lots of description words like ratchety, congested, robust. Gosh, what are some other ones? I don't know. Description words. I'm sure you'll hear me do a few in the demo. The amplitude more or less just talks about how powerful does that rhythm feel? How far does it go out? Does it feel like it's resourced? Is there gas in the tank? And amplitude really gives us a feel for something else called the underquality of the rhythm. And again, I would just call that how well resourced is the person's inner physician? How well resourced is this person's spirit? How grounded are they? How here are they? And then the last letter there is rate. And that's just how quick is it? Is it 6 cycles a minute or is it 12? All right, moving on. Demo time. The first thing I want you guys to do before I get Laura on the table, I want you to put your hands on your head. Put one hand on your forehead and put one hand on the back. And I just want you guys to feel for flexion and extension. Go ahead and put your feet flat on the floor. Take a few really deep breaths before you try this. And try to touch your head like you would touch a butterfly. You know how they have the little scales on their wings, and if you touch them too hard, the scales will fall off and they won't fly anymore. Touch your head that way. So then what you're going to be feeling you're touching your frontal bone and your occiput. You're going to feel the frontal bone sliding down towards your feet and then back toward the top of your head. And your occiput is following the same movement pattern. There you go. And just tune in. Allow yourself a little bit of silence. I'm going to tune into mine as well. And I'm headed into flexion. That frontal bone is moving toward my feet. It's about ready to turn around. There it goes. Frontal bone is moving up toward the top of my head. My occiput is gliding downward toward the floor. And we're almost to the end of that phase. Turning around. And I'm just going to be quiet for a minute and let you guys have your own experience. And I'm going to check back in with you in just about a minute. And I'd like for you to share, just a couple of you, if you felt anything, how it felt, what you noticed. Okay, you'll start coming back. And can I have a volunteer to tell me what that was like for you and what you felt? And if you guys in the room with me want to share, you're welcome to as well.
I can share. Can you hear me?
Yes, I can.
I couldn't feel anything on the front, and I'm learning, right, as you're teaching, but on the back, it almost felt like a pulse, kind of.
Yeah, that's a normal thing that you can feel.
Yeah, it was nice just to be still.
Oh, I know. Stillness is at the core of the power of this therapy, and that's really normal. Normally, like, you would devote the entire first class to learning how to feel just the basic rhythm. And honestly, nobody is very good at it for at least a year. So if you feel anything from that little demo, you're doing great.
Yeah, I thought, oh no, I can't feel anything.
That's okay.
Thinking,
you felt
yeah, I don't know if that was my pulse that I was feeling, like the rhythm in the back, maybe, or if it was what we were supposed to.
Well, I mean, there's really no supposed to. It's what you felt. And that means something to you, into your hands, to your body. We might not know exactly what that is in a left brain way, but that is your hand supplying you information. So we welcome that. That's good.
Right. Thank you.
Thank you very much. Would you like to share, Angel?
I was just going to jump in and just simply say I felt a warmth, kind of a heat, radiation of heat is kind of what I felt.
Yep. That's another thing that you can definitely feel. To me, it feels really warm. Okay. Let's get some hands on. Laura, let's get you on the table. Okay. So what I'm going to be doing is taking a look at Laura's craniosacral rhythm. I'm going to be talking about square. I'm going to be feeling at the dorsums of the feet, the long bones of the legs, at the rib cage, shoulders, and then the spots where we would take a look at the membranes inside the head. And I'll probably treat for about 3 minutes just to give you guys an idea what that looks like, and I'll narrate my way through it. Watching cranial work is a lot like watching paint dry. A lot happens internally, but you can't necessarily see it with the naked eye. All right, here I go. Okay, and Laura's body wants me to make very, very delicate contact with the dorsums of her feet. A lot of the time, that will indicate a system that is a little bit overwhelmed. It's got a lot of nervous, electrical feeling energy going through it. So that right there gives me some information. Okay. And I'm noticing that her left foot seems to be really connected up into her head. You can actually feel connections across the tissues of the body and sense motility patterns of things that are far, far away just by tuning in. So I'm going to tuck that information into my hat. I'm going to walk over here. Okay. And I'm noticing that at the right hip, she's a little bit outside herself. I begin feeling her bone, her femur, and I'm not on her body. So that tells me something is going on in here. I'm going to take a closer look. This is the anterior superior iliac spine, where I'm at right now, the front of the hip bones, that part that pokes out in sexy jeans. Here we go. And I'm going to actually talk about square on this side. It is a little bit ratchety. And I'm noticing there's more movement right now on the left than the right. So again, that tells me, look here. Let's see. And the rate is just slightly fast. I'm not going to really clock it. I just kind of notice in my own practice, is this fast, slow, or about average? And I'd say it's a little bit fast. So here would definitely be a place to look if I were treating today. And here I am at the lower ribs, the respiratory diaphragm. And I'm feeling pancreas, stomach, and spleen. And there's definitely, it feels a little disorganized, is how I would put it. So I might spend some time here too. And I'm also feeling something called her global epicenter. I don't really talk about this much in the presentation, but it's really jumping out at me. It's right here. This is a spot where all the different tension patterns in her body can be accessed with just one touch. That can be really, really helpful if you're dealing with somebody who is overwhelmed, who's maybe dealing with extreme trauma, maybe they're going through cancer treatment and they just can't take a whole lot of input into the system. Just by holding here, I can feel changes happening up here in the left shoulder and corresponding changes happening here. It's just a one-stop shop where you can direct some attention and get a lot done quickly, right? Moving on to her shoulders. Okay. All right, the left shoulder isn't moving. Right shoulder is. Okay, so I'm curious about the left shoulder because again, it was activating when I was here. So I'm tucking that information into my hat. I'm gonna come and I'm just gonna take a look. How is the vertical membrane system functioning? Ooh, and I have a model I can show you. This thing. So inside your head, you've got a vertical system, runs from about here to the bump on the back of your head at the very bottom of your occiput. That's called the falx. Vertical membrane system is really all you need to remember. And then you have a horizontal one, and that kind of wraps around your ears and the back of your occiput. It also contacts the inside of a bone called the sphenoid. Anyway, it's called the tentorium or horizontal membrane system. Just tuck that away. Okay, so tuning in to Miss Laura. I've got a hand on the back of her head. And okay, her vertical membrane system, it does not want me to put my hand on her forehead. It says, I'm compressed. I don't want any more compression on my head. I hit a stop right here. I don't know, a little bit less than an inch off her head. So I tuck that into my head. I'm noticing she has a nice strong flexion. Occiput is moving down toward the feet. And actually, her system has grabbed me and it's actually treating now. So I'm gonna hang with this and describe what I'm feeling. So the occiput is pulsing, 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 and I'm feeling a lot of nervous excitation in that left arm and shoulder. And the occiput is moving to the right. And I'm noticing that bone that I showed you, the sphenoid at the temples, I'm noticing that it's pulled over. It's a side bending lesion of the sphenoid. That's fancy talk for the sphenoid's pulled over and stuff is pinching. Okay, so the occiput is kind of hanging in there, bent inferior on the right. And it's going further into that. Okay, now it's going the other direction and it's let me go. So I'm going to take my hand away. Going to check on now the horizontal membrane system. This gives me information about just the lateral portions of the skull. Noticing, I don't think we're in synchrony. That means that one side is going in while the other side is going out. This can make us feel crazy. I'm going to treat this just out of mercy. So I am going to allow the right side to move medial in extension. I'm going to hold it there. I'm not going to let it go back out into flexion. I'm holding it. And I'm going to wait for the other side to come back into extension. And they're going to meet in the middle. It's coming. It's coming. It's coming. It's coming. Coming. Woo! Lots of excitation. I'm feeling stuff moving in the hips. And this is kind of a lot for her body. It's a lot to ask. I'm just holding space. Seems to be sorting itself out. I'm feeling heat. Okay. And we've done it. I'm going to monitor and make sure that we're in synchrony for real. Well, we are. Flexion, moving inward. Yeah, we're doing that at the same time. The left side is not as strong as the right, but we're doing it at the same time, and so I'm happy with that. I'm going to check the sphenoid. And again, the sphenoid is an attachment point for that horizontal membrane system. I'm just following. It's going to rock down toward the feet in flexion. Oh, it's moving up toward me, so that's extension. And I'm just waiting. It's taking its time. Oh, it's wanting treatment. Okay. So I'm holding it in extension. And it's sinking back and back and back. And we're kind of going side to side like a hammock. Woo, woo, woo. Okay, now show me flexion. And I'll do that sometimes. I'll talk to the body, be like, show me. Flexion is hard. Flexion is hard for this system. That's called an extension lesion of the sphenoid. You don't need to know that, but it means that the sphenoid moves more easily back into extension. That's why it had me pulling it that direction. So what you'll do a lot of the time in cranial work, if you find a restriction, you go in the direction of ease. You don't try to say, you have to go into flexion, you bad sphenoid. What's wrong with you? You let it go into extension, you wait for a release, and then you follow it, like I'm doing right now. Thank you, Laura, you're so good at this. She's going into flexion, and now I'm gonna just gently hold. I'm gonna say, well, how much more flexion can you do? You do a little more, and you do it. And she's accommodating that. That's kind of a big ask, but we're doing it. And I'm feeling some stuff down in her mouth, in the maxilla, that if I were treating for real, I'd probably get to today. And I'm feeling the sphenoid on the right go, wah, 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 wah. And now it's melting on the left. And that, I would call that a release. And I'm gonna let it move. And I'm just gonna see how well we've done. Yeah, we do extension. And we're moving further into flexion. It's hard for the left side of the sphenoid. I feel like it's kind of dragging or held, but it is actually going further than it was. So I'm gonna count that as a win. Okay. Now, I think now would be a good time to turn it over to you, Laura. What was that like for you?
Very nice. I mean, I always love coming to my appointments with you because I just, everything just seems to flow better. I do this motion with my hands, but I there is a lot of chaos in my life. So whenever I come, it's like just good to breathe. It just feels like everything gets lined out and straightened out. So I feel good.
Thank you for sharing that.
You bet. Thank you.
Thank you very much. Angel, would you like to come on? And don't go too fast.
Okay.
Okay.
Thank you.
You're welcome. I really enjoyed that. We have fine wine number 2. Are you a red or a white or a rosé, or do you have bubbles?
Ooh, I have bubbles. Can I do a rosé with bubbles?
Sure. Okay. So coming onto the dorsums of the feet. And her feet are okay with me having my hands there. And they say, Rachel, would you just stay here a minute? Sure I will. I like you. Says, thank you, I like you too. Now it's beginning to show me motion patterns in the pelvis. I'm really tuning into the pelvis, especially on the left. And I'm feeling the lower margin of the sacrum, coccyx area, especially the ligaments on the right-hand side. And I'm getting that if I wanted to work on that, a really good place to go would be the big toe here on her right foot. It's strange, but certain areas of the body are quantumly entangled. Like for instance, if I want to affect somebody's temporal bones way up at the ear, a trick would be to go to the hip bone and work there. Or at the ischial tuberosity, that's those bones on your butt. If you sit on somebody's lap and you're being a jerk and you grind your butt in them, those are your butt bones, it hurts. All right. So then coming up to the long bones. Okay. Yeah, they're showing me a walking motion. This is a lady who probably really likes to walk and likes to move. I'm saying, cool, I'm glad you like to walk. Says, it's telling me there's something going on with the knee. So I'm putting that, tucking that in my cap. And it's funny, the deeper in the body that I'm working, the further off the body sometimes my hands will be. I'm off of the body here and I feel like I'm accomplishing some work. Just gonna hang right here. I'm in the knee and there's some heat. Yeah, I could hang there for quite some time, I think. Yeah, tucking that in my cap. Going to the sexy jean bones. And the right ASIS is moving. The left one is, but it's hung up. It's hung up. And what I'm feeling, it's not a bony restriction so much, it's a soft tissue restriction. And in her case, her body is liking it for me to just put my hand right there. She's doing a lot of her own work, which is fabulous. Means less work for me. And as I just hang right here, I'm feeling her SI ligaments wiggling. Those are on the back. You can think of them sort of like clothespins that hold the sacrum onto the ilia. What I'm getting also is that if I were treating today, it'd be a really good idea to actually go under and between her legs and to the sacrum and tune in there. Seems like that would be a really nice, yummy thing to do. I might do it in a minute. No, I'll do it now. Go for it. Okay, there we go. Okay, and I'm just gonna tune in to flexion and extension. And single bones, they don't really so much move lateral and medial, they move toward the feet and toward the head. Right now we're moving toward the feet. And the sacrum is bent over to the left a little bit. There's a really pretty big pull on the lateral left border of the sacrum, and it's attached to this ilia. What I'm gonna do, I'm gonna just do a SI ligament release with about like 5, 6 grams of pressure. I'm just pushing that hip bone medial. And I'm feeling those SI ligaments let go, and there's a trembly sort of a feeling, so I'm just gonna hang with it. There we go. And I'm feeling increased fluid flow. The body's asking for me to compress a little bit more and a little bit heavier, and into kind of the muscles, tensor fascia lata. Oh, there we go. There's a trembly energy. I'm gonna hang with this. And I'm feeling a correlation into the jaw. I think if I look here in a second, I'll find that the jaw tracks off to the left as well. Okay, sacrum moving into flexion, and feels like it wants just a good, strong traction down toward her feet. So I'm supplying that, and I'm feeling the ilia just come back. There we go. And I'm compressing. She's doing most of her work. We're going into extension, and a lot of heat is coming out. I feel it on my underhand, my sacrum hand. As I do that, I'm feeling some shifting happening in the right arm and shoulder. I don't need to know why, but it's definitely happening. And just chilling. We're actually in a still point right now. That means the body's doing something really important, and the cranial rhythm is shut off. A lot like how if you're doing something super, super important involving electronics, if you're really in there tinkering, sometimes you have to turn most things off and get things functioning at a really chill, low level. There we go. That way we don't fry the system. Okay. And we've completed that release, and it's telling me to work on the psoas. I'm gonna move on. because that was a good release. You did so good. Awesome. And I'm going to have you talk about how that felt in a minute. Okay, there's not much motion here at the ribs, and that's a pretty important restriction to address because the diaphragm has a lot to do with our breathing and a lot to do with the vitality of our system in general. So chances are, if we open this restriction up a little bit, whatever it is, it would really improve just her energy level. So if I were treating for real, I'd probably do that. And then I'm wanting to grab her wrist. Sometimes I don't know why, but I feel like I want to grab a body part. There's a lot that happens in the wrist. You have the pericardium meridian. It supplies energy to the little sac around your heart. I think that's what we're working with. Yeah. Yeah, it feels like, so in Chinese medicine, the pericardium meridian, it has to do with the wall that we put around our heart. It's called the heart protector in their system. And it's just wanting me to jiggle kind of at the wrist where it ends, just jiggle. And I'm feeling it like a lava lamp around the chest, heart area, and it's settling down. Okay, thank you so much. And then I'm gonna go to the shoulders. And I'm feeling the right shoulder when I'm off the body. That means that's a good place to work. Let's see. Yeah, it's saying it's throbbing, which tells me, ow, Rachel, sometimes I really hurt and I don't like it. Good to know. Good to know. We'll see what we can do. And I'm feeling a pull. I want to come and pull right here. Sometimes we'll do something called fascial drag. The fascia of the body, you know, like that white webby stuff you see on a turkey at Thanksgiving when you're preparing it. We have that too, and it's called fascia, and it's continuous throughout the body. It wraps around every single muscle cell, as well as muscle branches and fibers. And so a pull here can pull all the way down into the legs sometimes. You just never know. And I've got my hand on the occiput. Okay, and I can make very light contact with the falx. Notice the occiput is moving more than the falx is. More than the membranes in the head, I should say. Yeah, so I'd be curious. It makes me wonder if there's a restriction up here where the falx inserts onto the ethmoid bone here. Gives me something to think about. The second vault hold. Well, it's telling me about this sphenoid. Tell me flexion and extension. And it's saying that it can't move on the right. That hip is just stuck and it's putting a drag on the whole system. And oh my gosh. Yeah, feel ya. And her inner wisdom is telling me to stroke the side of her head. So I'm doing that. And moving out into flexion. Okay. It feels a little disorganized, so I would just go in, probably. First I'd work that hip, and then I'd go in and I would see if I could just hang with each phase of the rhythm and see if it wants to organize itself. It may not. Just like my house, it's kind of cluttered. I'm good with that. She may feel the same way, but I'd probably give her system the opportunity to tell me one way or another. Tuning into the sphenoid. Okay, we're moving into extension. Sphenoid's rocking back toward me. It's a nice rock. And we're moving forward, but that's harder. we have a lateral strain lesion of the sphenoid. Oh, ladies and gentlemen, that means, okay, hang on, sphenoid. I'm not abandoning you. It means that sphenoid is pushed this way. Should be in the middle, but it's pushed. And there's also a side bending thing going on, secondary to the hip. So these are really important things for me to know. Again, I would not force sphenoid to do anything that it did not want to do. I'm just going to see, what can I do for you right now? It says, oh my gosh, just please work on this lateral strain lesion for a second. Okay, girl. So I'm asking sphenoid to go in its direction of ease. It's moving toward the left. And I've got the occiput stabilized. I should say that. Y'all don't really need to know because y'all don't do this, but that's important in cranial lingo. I have stabilized the occiput. Okay, now we're moving the other direction. We're correcting. And I'm feeling, so usually a lateral strain lesion will happen from an actual blow to the head or neck. And I'm feeling it's connected to whatever happened at the hips. And I'm just hanging with sphenoid. It's correcting. It's doing what it needs to do. It's just kind of resting. It's like it's going. In fact, I'm going to do that. That seems to be helping. Okay. Now it says pull me up toward the ceiling and I'll figure myself out. Okay. Okay. And I'm just going to wait until her body gives me a clear exit ramp. The sphenoid's really important and I don't need to be causing problems. It says, will you please take care of my extension lesion? I'm doing the same thing as Laura. I'm rocking back. It's hard for me to rock forward. Okay. And now it's rocking forward. And we're doing better. We're less ratchety. This will be okay. Do you want to share?
Yeah. Especially when she was talking about the right leg, I would feel just kind of an opening, and then I'd feel a twinge in what I'm going to say in my muscle, of just lack of term to call it, of just an opening and of release felt. Mm-hmm. Now up here where you touched something and I felt it down in my leg. Mm-hmm. I don't remember what that was.
Maybe your sphenoid?
Yes.
Yeah.
And again, just felt just an opening happening and like muscles twitching in that. And before you would say it, I felt it.
Isn't that wild how that is?
So it was like I would feel it and then you'd say it. It's like you'd speak the terminology that was happening.
Mm-hmm. And it's funny, sometimes just saying what you're feeling makes the body reorganize and it'll fix itself. Mm-hmm. I don't have to do a thing. It's really wild.
Yeah.
Gosh, I think probably the best thing to do would be to open it up to you guys. If you'd like to ask me any questions about anything that you just saw. Maybe there's no questions. I guess I did a really good job.
I know I can speak, if I can bring the idea of the Enneagram into this, and being very body related. I'm very I'm very into the body. And I was feeling so much of what you were saying in your feeling, your light touches, just barely touching, but like just, I'm going to call it a heat energy coming off. And when you hit the places to where there's been a trauma, be it a physical trauma or be it where my trauma is stored, I can feel that heat up. It's like a slow light, that like a heat warming light, just come on in that.
That's awesome. Thank you so much for sharing that. Do you have anything to contribute, Laura, or should we just move on?
So I just wanted to speak quickly from a personal experience, because I've been a client of yours for a long time, and I'm not a massage person. I'm not in tune to my feelings or anything like that. But in particular, when I was going through menopause, I was having really, really super severe symptoms, and could not sleep at all any night, hot flashes through the roof. And Rachel was working on me, and she, was going through everywhere, and specifically was like, you need to get your thyroid checked. Get your thyroid checked. And
this goes outside.
And when I went and got blood work, it was found that, and I'm not a medical person, but I think my thyroid was overactive, and I ended up getting on some medication, and the symptoms decreased dramatically to almost non-existent. And that was something I had been battling with for a long time, using, the different hormones and just a lot of different things. I don't take any hormones now. The only medication that I take is that thyroid medicine. And my life is like completely different. I can sleep. I don't have the crazy hot flashes. Not that I never have a hot flash, but it's night and day from when it was. And you called it out and told me to check it. And, within a couple of weeks, that blood work was like, oh yeah, this is a problem.
Woo!
Very good. Very good.
Thank you guys. Thank you guys so much. All right.
Thank you.
Oh, you're welcome. So I hope that gave you guys just a really thumbnail sketch of an idea of what a session is like. Normally, it would be much quieter. It would be more focused. I would take a look all over, and then based on what I'm feeling, what the body tells me to do, I would stay there. I might engage some dialoguing, and in a second, I'm going to tell you a little bit about how that goes. But say I was wanting to know what's going on at diaphragm and what's restricting breathing. I might look to see if there's held trauma there in the form of an energy cyst. And again, that's a word we're going to discuss in a minute. And I might get Angel to connect to it and let me know, what does it feel like? Does it remind you of anything? Sometimes people, memories come up, and then you just support them where they are in a nutshell. Anatomy time. All right, so the membranes. You see a really intricate looking picture right there. I want you to look at the picture on the bottom. You can pretty well ignore the one on the top, unless you just like it better. They're showing basically the same thing. But at the bottom of that lower picture, that big shape in the middle, the spongy looking thing, that's your brain. And then going out from that, you have a tiny, tiny, tiny little membrane that adheres directly to the brain. And that is the most intimate and the softest and the thinnest cranial membrane. That's the pia. Pia mater, if you want to get technical. That means soft mother. And then right above that, you have the subarachnoid space. And that's just a little area that's filled like an aquifer with cerebrospinal fluid. It flows out from the ventricles and up into that space. And you're going to see a video in a minute of how that works. So don't get too bogged down in details. Just listen for the key words, the names of the membranes, where stuff is. In the subarachnoid space, you have little spider-like projections. They look like parallel lines in that little aquifer space. And those are called trabeculi. They look like spiders, and they give the name to the next membrane layer going up toward the skin, the arachnoid mater, or spider mother, because the trabeculi look like spiders. And above the arachnoid, you have the dura mater, and you have a dura mater that adheres directly to the bone, and then the inner or meningeal layer. And I mean, really, y'all just need to know dura mater. That means tough mother, because it is one tough mother. And on top of that, you've got bone, and then the vasculature for all the muscles and fascia that you can actually touch on the top of your head. All right, and moving on. So we use the bones of the skull and the spine like handles to access the membranes. And what you should know is that bones are a slave to the membranes underneath them. That means if you have a tight membrane, it's going to pull on your bone. You can have an override in your parietal bones, the bones at the top of your head from birth, just from being squeezed out of your mama. And it can be deformed. It can be the membrane in there and the bone if you don't get it corrected. But what we would do in treatment is to just hold that parietal bone and say, oh, honey, do you need to do something? What can I do to support you? And it'll do its thing. And we free the membrane in that way. The bone doesn't just snap back down, because bones are slave to membrane. And just keep in mind, the organization of a person's membrane system is absolutely foundational to their physical and their mental health. You've got cranial nerves in there that are going to impact your ability to speak, your glossopharyngeal nerve, right? You've got your hypoglossal nerve. You've got 12 of these really important nerves that govern your ability to see, to feel, to digest your food. It's important. Those membranes also are going to have a lot to do with your hormonal systems. I know I was going on and on about the sphenoid, but one thing that you need to keep in mind about it, it's got what looks like a saddle in the middle of it. It's kind of a butterfly-shaped bone, and in the middle of that butterfly, where the body would be, is what looks like a saddle. And that saddle holds your pituitary and your hypothalamus. And if those membranes are tugging on that sphenoid and things are just not right, then that is going to impact the systems of your body that have to do with hormones, communication between the cells. It's not a good look. It's good to get in there and get that all ideal. Okay, moving on. Okay, so the membranes. Here's a graphic for what they look like. We'll start at the picture on the left. It looks like a spaceship, and the top part that looks like a sickle, that's the falx, and it attaches kind of where your third eye would be, on your ethmoid bone, on the crista galli of the ethmoid, if you want to be really specific. And then it goes all the way down, kind of bisecting the hemispheres of your brain, back to that bump on the back of your head. The internal occipital protuberance. I love words. And then we have the horizontal part. That's the tentorium. And we just call it the tent because that's simpler and a little bit less pretentious sounding. And that one is going to attach to the sphenoid, kind of in the front, and then back along the lateral sides of the skull, kind of around your ear bones on the inside. And then there's a little hole where the dura mater, that tough mother membrane, it just folds itself around the hole in the back of your skull. The foramen magnum, aptly named, that means big hole. That's where your brainstem comes out. It wraps itself around there, and then the dura continues down the length of the spinal cord, the spinal dura. Okay, so you can see if you look at the image on the far right, that's the points of attachment for the dura, and you can see it's kind of tadpole shaped. The dura covers the entire cranial vault. It kind of origamis itself into the horizontal and the vertical membrane systems. And then it has little filamentous attachments at C2 and C3. And then again on the anterior or the front of the second segment of your sacrum, and then down into the periosteum, the stuff that hugs the bone real tight of the coccyx. So that should give you guys an idea of the nuts and bolts of what's happening in there. Go ahead. Okay. And within the arachnoid membrane is the cerebrospinal fluid. And again, that is a filtrate of the blood that's made inside the ventricles of your brain, those water balloons, by the ependymal cells of the choroid plexus. The fluid cushions your brain and your spinal cord. It brings nutrients and immune cells to that delicate neural tissue, and it removes waste from the central nervous system. And actually, there's a specific system we've discovered within the last about 2 years or so that actually removes the waste from your brain, and it's called, just so you guys know, the glymphatic system. Not lymphatic, glymphatic. And the fluid also seems to have a spiritual resonance to it. Guys, it's the first rhythm to come online after conception. You can begin to feel it with your hands at around 13 or 14 weeks. And it is the last rhythm to stop after clinical death. It stops after the heart, after breathing, after all of that. It takes about 15 minutes, give or take. And this is a quote I'd like to share by William Sutherland. He was an osteopath around the turn of the century. And he had a lot to do with proving that the positions of those cranial bones really, really matter. He looked at it more from a bone perspective, where craniosacral is more interested in the membranes. But he did prove to himself, at least, that how those bones are sitting really does matter. And he was right. He said, within the cerebrospinal fluid, there's an invisible element that I refer to as the breath of life. Visualize a potency that is more intelligent than your own human mentality. Ooh, visualize a potency. Basically, visualize that force that makes you alive, is what he's saying. I just love that. Go on ahead to the next slide. So the pressure stat model, you know, I could spend a couple of hours just on this. So I'm just going to tell you the things that I think will stick and that actually really matter. So craniosacral therapists explain the way that the cerebrospinal fluid moves with the pressure stat model. We suggest that the craniosacral system works a lot like the thermostat in your house. It's a semi-closed system, just like your house, and it regulates the flow of fluid within the semi-closed boundaries of the meninges with an inflow and an outflow mechanism. So production of the fluid occurs at twice the rate of reabsorption, but only half the time. That's really what you need to keep in mind. And now there is going to be a movie. Somato-emotional release and beyond. And this is where it's important for you guys. And I'm going to be racing through territory. So just perk your ears and take it in as a gestalt. We have the inner physician. Again, that's that part of you that knows what's going on and knows what you need. You've got the significance indicator. And then again, that is a meaningful and significant pause in the cranial rhythm that I don't induce myself. It happens. It indicates that something important is going on. And then I'm just going to run through these other terms: nonlinearity, neutrality, arcing, positional release, and the energy cyst, and therapeutic imagery and dialogue. Just keep your ears perked. Let's see. Go ahead and move me forward. So again, the inner physician, we're all obsessed with something called the inner physician, also known as the inner wisdom. Ideally, the inner physician is in charge of everything that happens during a session, and I'm just there to facilitate. It tells me what to do, and I take the orders. Everyone has a doctor in him or her. We just have to help it in its work. The natural healing forces within each of us is the greatest force in getting well. That's a quote by Hippocrates. Right? The significance indicator, again, that's an abrupt cessation of the cranial rhythm, and it indicates that a process of importance is happening and that I need to stay where I'm at and pay attention. And you can trigger the significance indicator by moving the client into a significant body position. For instance, at one point, a person's inner physician told me to get her hand and bring it to her head, kind of pulling her hair. Her rhythm stopped, and she was reminded of an abuse incident where she had her hair pulled. The memory in her tissue is what caused the significance indicator. And then we could go in and process through what happened. So it can be triggered also by just a thought that crosses the client's mind, from an image that pops into their head, or if I request to speak with the inner physician, it can come forward as Santa Claus or a seagull or Jesus or what have you. And that rhythm will stop, and I'll know that we're doing something important. Okay, go on. So nonlinearity, how the elbow can be connected to your butt. A lot of the time you'll find this principle in the feet. You can go to the foot and tap on somebody's metatarsals and get a massive release in their neck. This happened toward the end of a session. I was working with this woman and I felt what was like an electric fence at her foot. We still hadn't worked on her neck, and I was beginning to sweat because that's what she came there for. But I'm in this really intense electric fence on her foot, and I'm tapping and I'm just kind of playing with her foot, and I'm hoping she's not going to kick me for not working on her neck. And all of a sudden her neck pain went away. Can I explain how that happened or why? No. But we know through fascial continuity and just through the principles of holism that the body is a unit. And we know that small forces can have unexpected, huge effects globally. That's the quantum nature of craniosacral therapy. The elbow can be entangled to your butt or your foot to your neck. Go on ahead. Neutrality, especially when we're talking with somebody about something that happened. We don't take sides. We don't co-sign. We don't have agendas. I'm not going to try to make somebody cry. That's obnoxious. I'm not going to try to make them deal with whatever issue it is. Because honestly, I don't know what they need to do during that session. Their inner physician, Jesus, does. So I go with that. I don't fix. That takes a lot of the stress out of my job. If somebody has an issue and they come in for it, I listen to their body, and hopefully, like the woman with the foot and the neck, it resolves. Sometimes we have to go in nonlinear paths, and I have to remember my job is not to fix that person. Yeah. So somato-emotional release and the energy cyst. That there in the middle with the globes coming off of it, that's an energy cyst. So sometimes life shoots a bullet at us. And when that happens and we're not well resourced enough to dissipate the trauma, and that trauma can be emotional, it can be physical, it can be chemical, it can be spiritual trauma. it gets walled off in the body like a cyst, and it causes a lot of trouble in the area where it's located. And you can feel those things with your hands. You can feel those arcs coming off of the body. You can even do it from off the body. And the closer together and the more powerful the arcs, the closer you are to the energy cyst. So we kind of do a complicated echolocation. Go ahead, Laura. How we treat those. We might just do arcing. Again, that's feeling those waves, and positional release. If you look at the diagram on your right, you have a lady busting her butt and she falls down. Ah! A, those arrows, those quanta of force go up into her sacrum and ilia. B, she hits again in a different position, different quanta of force go in slightly different angles, and then onward through C and D, and finally she's a hot mess. So positional release, we would line back up those quanta of energy. Energy likes to leave the body in the same path that it comes in. So it would be a matter in this case of maybe her inner wisdom would carry us to the feet, and we'd move with the body, and the body would show us a significant position. Boom, the rhythm stops. Energy comes out, moves a little bit more. Boom, significance indicator, more release, and we would just go on like that. If there was an emotional component to what happened, maybe her husband pushed her, maybe she just got fired from her job, maybe that's a part of the felt experience that ended up with the energy cyst, we would engage that with therapeutic imagery and dialogue. And to solicit an image, we would ask for the inner physician, Jesus, God. We work with the person's beliefs. We'd ask it to come forward and communicate. And the cranial rhythm will stop when anything significant comes forward. And when it stops, it's a little bit like musical chairs, but we ask what they're experiencing at that moment, and we encourage a candid, unedited response. And we get to know the image. We ask it, what can we do for you? Do you have a message? Sometimes there'll be a message about lifestyle factors. Sometimes a memory will come up. Sometimes it's a wild goose chase. Maybe the woman will start talking about spray cheese and you'll have to ask, okay, so tell me about spray cheese. You track it down. You ask it, do you know the impact you're having on the patient's life? And sometimes if the pattern is there, sometimes it's a punishment in the non-conscious's mind. Like in the case of, for instance, molestation, there might be a chronic pain pattern or infertility, female issues happening, and it might be the body's response to guilt. You can say, does the punishment fit the crime, and process through there? Or is there a more pleasant way that we could accomplish the same thing and not make this person a basket case now that you have their attention? In any case, you negotiate respectfully and you do your best to work toward forgiveness. And if possible, even if it's really heavy, you end laughing if that's appropriate. Okay, so that was a lot. Do you have any questions or comments for me?
I don't think I have any questions. I have a high five, way to go, Rachel Carter, miracle hands. And because Angel did the intro this morning, I don't think that I let all of our staff know that actually Rachel Carter is my massage therapist and has worked miracles on my body for about 2.5, 3 years. And she originally came to me by a referral of a friend who says, this friend was on narcotics for like 9 years for chronic back pain, and she was trying to get off the narcotics, visited with Rachel, and she said, after Rachel's working on my body, I like sit up on her table a different person. And for someone who has experienced chronic back pain for 9+ years, or at least narcotics for 9+ years, and 2 back surgeries, I think, at the time, that really stood out to me. So I thought, well, I'll I don't battle chronic pain, but I had some neck challenges, and so I reached out to Rachel, and that's how we first met. And I just instantly, I liked her before I met her hands, but once I met her hands, I'm like, wow, like, how did you do that? I was floored. I was pretty amazed. And Rachel was instrumental in releasing a boatload of tension from my neck and shoulders area. So anyway, I just wanted to endorse that with personal experience. And I'm thrilled that Angel could set this up today. And that we got to learn a little bit about the left brain part, which I think translates more easily in a teaching platform like this. I think it's incredibly difficult to translate the kinesthetic and miracle part of that by only a visual format. And so I would encourage each of you, if you are inclined in the least toward exploring Rachel's miracle hands for yourself, I would strongly encourage you to do that. And then as Rachel may bring healing in your own body, then maybe you're interested in letting her know what you specialize in. And that's part of developing a system where we each refer to each other. Building business, serving God's flock.